in America, land of the free, home of the brave. You all know how it works when you're buying things in this country. You walk in, you get prices, and you make a decision. We love our fast food in America, and we like to see what it costs. Part of living in a country with a free market is having price transparency, which is our ability to access clear and accurate information about the costs of stuff. But have you ever asked yourself, why are prices never listed or even mentioned when you're in a hospital? At the gas pump, they not only give you a price, but they even show you how much it's going to cost in real time, all the way down to the thousandths of a gallon. You can even order meat by the ounce at the grocery store. But what about the price in healthcare? I walked into various hospitals and clinics and asked what it would cost to be seen by a physician and have a simple x-ray taken. Hello, ma'am. I was wondering, could you ballpark like how much it would cost to get like an x-ray and be seen by a doctor?
We don't do the billing.
How would I know like ahead of time, like what it would be paying?
You'd have to make her an appointment, and then you'd probably have to contact billing for that.
And this isn't a normal health clinic. This isn't urgent care. So according to this lady, during an emergency, I just need to get on the phone and call and make an appointment to find out how much everything's going to cost. I need to make a decision like soon. What do you think I should do?
That is up to you.
Well, that was a fail. Let's try to look somewhere else.
So I can't give you pricing on anything. I mean, I don't even know the pricing to be able to give you.
Can you ballpark prices before I come in? No? Okay.
Wish I could, but
Even just like how much would it cost to like talk to a doctor, get an x-ray? Like
I can't.
Okay. All right. Less than half of the locations I visited could even give me anything better than a vague estimate. And I didn't ask them what it would cost to fix some unknown complicated injury like abdominal pain. I told them exactly what I needed. And let me say this, the healthcare professionals were amazing. This nurse was frustrated with the lack of price transparency in healthcare, and he went above and beyond. Not only did he try to ballpark numbers for me, but he even offered to do a quick checkup to give me some advice.
$3 grand.
Okay. And that's for just like x-ray.
I mean, like the ER visit, and I hate this stuff too, believe me, is about $1,000. I'll put you a low acuity.
Okay.
And x-rays probably going to be about 200, 300. And then the radiologist has to read it. He charges a couple hundred.
Yeah.
Come back here.
No, I mean, I'm okay. Here.
This is a freebie. Broken collarbones, unless it's a horrible fracture. All they do is put them in slings and they heal on their own.
Yeah. And who says we don't have free healthcare in the United States? Shout out to this all-star nurse. You are awesome. And on my way out of the ER, I bumped into a paramedic in the loading area, and I took the opportunity to inquire whether patients commonly ask what the cost of service is. And sorry about the terrible camera angles. It's harder than it looks pointing this thing in the right direction. Have you ever had anybody ask you, like, hey man, what?
Absolutely, every day. You know what I mean? And unfortunately, I gotta tell them just the generic, like, I have no way to know. Like, you know, like you'll get something in the mail. I'll get your insurance information. We'll do the best we can. You know?
Yeah. And he was able to direct me to some resources to find more information, but who has the time to do this in a real emergency? And while I got a bit of information about how much ambulances cost, I can't imagine this sort of price transparency being accepted in other industries. And think about this, if you were at a restaurant and asked what things cost, what would they do? They'd hand you a menu. Not one healthcare provider at any location I went to offered me any sort of tangible price sheet or lookup table. And when I did get decent price information, it was mostly from freestanding, privately run urgent cares. For example, this lady had prices on hand and was able to give me a straight answer to my question.
So with an x-ray, it'll be $205.
Do you have to be seen by a physician to get an x-ray, or how does that work?
That cost includes the visit.
But what is astounding is how different the prices can be from place to place. A real ER could be anywhere from $2,000 to $3,000. And in urgent care, we're quoting me as low as $200. When prices can vary this much, you need more price transparency, not less. Some people would say that healthcare is complicated. It's hard for a hospital to give you straight answers. But is it more complicated than buying a plane ticket? The airline industry is very complex, with many variables that can affect the price of a ticket, such as the time of day of the week, cost of fuel, and the length of the flight. And airlines are required to disclose the full price of the ticket, including taxes and fees, months before takeoff to customers before they purchase it. But I will concede that airlines have it a bit easier in some respects. For example, they can lump hundreds of customers into a single plane. Imagine trying to give the same treatment plan to a lobby of patients. Granted, healthcare is uniquely complex in some ways, but the doctor could still disclose the price of tests or what the hospital bill's total is periodically, or at all. Most of the time, you get the bill a month or two later. And you might say the reason for all this is greedy hospital administrators wanting to charge you $50 for an aspirin when it only costs them 5 cents. And hospitals do assign somewhat arbitrary prices to things. But when you look at the facts, hospital profit margins are not high, around 4.1%, well below accounting, software, and just above grocery stores. They aren't overcharging that much at all when you factor in all their costs. But I did find a specific segment of healthcare that does list their prices. So much so that I didn't even have to go to the clinic. They advertise prices and love for you to call and ask for more information. I was wondering if you could ballpark like some numbers of what it would cost per eye and how all that works.
$2,299. We also have a discount of $1,000 off.
$2,900 per eye. It's about $5,800 total. We are running a promotion right now though for $1,600 off that total cost.
It can range anywhere between $1,099 per eye and can go to $2,395 per eye.
Or $4,800 to pay in full for both eyes. $100 off each eye, so $2,000 per eye.
Okay. And the difference being, clinics that don't accept insurance, that do elective surgeries, have no problem with price transparency. They know the vast majority of the clients are paying with cash.
There seems to be a deeper issue at play here that goes beyond hospital administrators intentionally hiding price information from patients. It's unlikely that there is a group of administrators secretly colluding to keep patients in the dark. Instead, it's more plausible that there is a systemic problem in how we pay for healthcare that creates a perverse incentive. We often think of prices as concrete, set values that things are worth. When I arrive at the fuel pump, everyone is paying the same amount. And yes, the price of fuel can be different around town, but we all have the ability to fuel up and be treated the same. But in healthcare, each patient can be billed differently for the same care. Remember when I said it can take a few months or more to get your bill in the mail? That lag time is mostly a period where insurance companies negotiate, audit, and settle on a final price.
The truth is, especially in more complicated visits, it's not known what the hospital will bill you for, or what the final price will be during your stay. And while millions of Americans don't have health insurance, most do. And even with insurance, everyone's paying a different price. The uninsured are given arbitrary prices to cover hospital expenses. $50 for an Advil because the clinic has to keep a nurse around to administer it. And she's on overtime because her coworker got COVID. And the patient before you probably won't pay their bill. And the patient after you has Medicaid, which doesn't quite cover the cost, but the hospital wants to accept them because tomorrow Medicaid might cover a surgery that they will need, which could turn a profit. You see, it's complicated. This nurse intuitively knows hospital pricing is all over the place.
$3,000.
He was right. Most Americans have health insurance, and when they interface with a healthcare provider, neither the patient or the doctor really care what the prices are. The doctor and nurse get paid a set rate to do their job, and the patient pays a premium and a standard copay. They don't list prices because they are irrelevant for the most part. So what's the solution to this mess?
The Consolidation Appropriations Act of 2021.
This bipartisan piece of legislation included the price transparency requirement. And look, it's only 2,100 pages long. And it requires hospitals to list all prices online.
But here's the thing. The law doesn't require anyone to be on site that is able to answer questions. And they could take over 24 hours to respond to a request. And it has poor compliance, which I tested myself. And it doesn't apply to clinics, only hospitals like these right over here. And even if people could price shop, they won't, because as we discussed, people look at what their insurance companies charge them for premiums and copays. They don't price shop at all. Imagine if your insurance company charged you the same amount if you fill your car up with gas, regardless of the gas station you use. You wouldn't care whether they had price transparency or not. So essentially, the price transparency requirement is useless. Lawmakers have added another healthcare regulation that does essentially nothing for the consumer.
Then what's keeping patients from bankrupting insurance companies by spending too much? You have this situation where you have a dangerous loop. The patient wants to consume as much healthcare as possible, and the hospital and doctors are incentivized to perform as much as they can to increase revenue. So what is stopping this whole thing from getting out of control? You've probably heard of prior authorizations. This is when a hospital has to ask the insurance company to pay for a procedure or medication that requires an explanation or proof that the patient needs it. It's usually when something is expensive and or abused. But even still, hospitals come up with all sorts of tricky ways to game the system. One time I broke my collarbone, and it was bad enough that I needed surgery. They were okay sending me home and scheduling surgery for the next few days, but they required me to stay overnight in the hospital if I wanted surgery that morning. It didn't cost me any more money to stay overnight, but the hospital got the leave the IV in and bill for an overnight stay. And because I was on pain medication, I need to be monitored. It was billed at a much higher rate than a simple observation. And from a scheduling perspective, they could fit me in between emergencies that were rolling in. This probably doubled the amount of income the hospital took in, and I personally didn't pay any more for it. Many people might wonder why insurance companies don't try to rein in healthcare spending by pushing back against the high costs charged by hospitals and the providers. After all, isn't it in their best interest to act like the greedy capitalists and protect their bottom line? Because the insurance companies love that we are all spending more on healthcare. And how could this be the case? The Affordable Care Act, aka Obamacare, brought with it a strict medical loss ratio requirement. It states that insurance companies have a set margin that they can use for administrative costs and profit. The majority of the funds coming in must be spent on healthcare. This is because insurance companies want to be involved in as much healthcare spending as possible, as they can only take a percentage of the premiums as profit. And this is what happens over time. Premiums and healthcare costs have continued to rise year after year. And if we look at healthcare in America, we spend the most per GDP. And while it's true that insurance companies don't want you to spend millions of dollars unnecessarily, they do want the average person to slowly, year by year, spend just a little bit more. This means that the larger the pool of money they are involved in, the higher their potential profits become. As a result, insurance companies have a strong financial incentive to cover as many healthcare expenses as possible. And this is how we've arrived at this point where you can go to the hospital and the patient doesn't really ask how much things cost, and the doctor wouldn't know anyway. The American healthcare system is a lot of things, but one thing is for sure, it's not a free market. Where do we go from here? Well, we'll have to continue this topic in another video. And for now, you could watch this video over here. It's about something amazing, I'm sure. Or perhaps this will suit your fancy over there. Yeah. This is a bit awkward.